low vitamin D itself doesn't directly cause high calcium. However, it can lead to what's called parathyroid overactivity. And so it can indirectly raise calcium levels over time. And so the vitamin D levels might be something that you want to be mindful of as well. So that way it can support your parathyroid as we're starting to balance out the hormones. Um, Standard, level of vitamin D that can be recommended is around 5,000 IUs, especially during this time of year. It does it's a little bit dependent on the region that you live in. Okay, so just to be mindful of those of you that are in more sunshine states and closer to, those southern states. But that's a pretty generalized recommendation. If you're curious and have to know, the ranges, we've talked about this before, but it's worth making note of because it's such a foundational component to healing in reality, and especially at the cellular level, is, if you have to look at your vitamin D levels on your labs, if you do have those with your physician, then anywhere from 30 to 100 is considered normal medically. But and the practitioners can attest to this, but I know I've seen this personally. People are literally like walking, talking zombies sometimes until they get into the 60s. So you could go into your doctor and have a 35 normal vitamin D, and they'd look at you and say, "Okay, you're at 35, normal. You're considered normal." No, that's not a worry. Why?
Yeah.
Because you're in this normal range of enormous range, from 30 to 100, right? But anywhere from 30 to 55, 60, when you start to get into the 60 ranges, that's usually when people start to notice a difference. And that I'm referring to that range that would be seen on your blood work if you do have that. So even if you have old blood work and you've have your vitamin D, feel free to go look. It's most relevant within 6 months to a year, usually 6 months for vitamin D. So if you haven't had that checked, that's a one-off lab that they could check, if you're just curious. But that also could be a consideration there. So just because you're taking calcium doesn't mean it's going to elevate the calcium, in other words. So I want you to be mindful of that. And then if the vitamin D is low, that can impact the parathyroid, which then can, as a result, elevate the calcium in your blood.